what should you do if you're having constipation after bariatric surgery? Because your volumes of eating are going to be so much smaller, it's very normal to get constipation, and it may be a few days before you have a bowel movement. If you feel like things are getting backed up, what I recommend to get things moving is milk of magnesia. You can put it in the same 1 ounce medicine cup you've been using for your diet. Just recognize that this one is 2 ounces, and so you don't want to be drinking 2 ounces, but just 1 ounce. And you can drink 1 ounce every 4 hours until you have a bowel movement, and that'll get your bowels moving. After the first week or two, you may need something to help more long-term keep your bowels moving. And in that situation, I recommend sugar-free Meta Mucil. Now, this is a little tricky to take when you have a small gastric pouch, so I'm going to try to demonstrate that for you. So what I recommend is 1 heaping tablespoon in about 8 to 12 ounces of water. So you take that out, drop it in, and then just stir it up. Now normally with Meta Mucil, most people like to just drink it down really fast because it starts to thicken up. But you can't do that with a small gastric pouch, so use your little 1 ounce cup, pour out the amount you can, and then just sip that down. And again, depending on how fast you're able to drink. Now, you may need to wait a few minutes because your pouch is accommodating, and so it's not time yet to take another drink. And as you wait, this tends to thicken up. Now, for some people, they don't mind that, and so you could just pour the next one and go right ahead. But if it's too thick for you, he's like, oh, I don't like how thick that is, then what you can do is just add some more water. So you thin it out, stir that up again, and then it's back to that thinner consistency. You can drink that and then wait a little bit of time, and eventually you'll get enough water in there that'll be thin and it won't thicken up anymore. But you can get through the whole glass that way. That was actually taught to me by a bariatric patient who had figured out how to do it, and that seems to work really well for getting the Meta Mucil in.